and welcome to the Contrary. I'm host Bonnie Urbay. What is the economic impact of the coronavirus on women, and particularly poor women of color? The Institute for Women's Policy Research is a leader on studies about issues affecting women, and today IWPR President Dr. C. Nicole Mason joins me to talk about the work they're doing on women and the impact of the coronavirus. Welcome, Dr. Mason. How are you doing?
Pretty good. Thank you so much for having me. And this is such an important conversation, and I'm so glad to be a part of it.
Well, you're wonderful for giving us your time in these very busy and, quite frankly, depressing times, especially about when it comes to people of color and the economic impact. First of all, tell the audience, if you would please, a little about what IWPR does.
So IWPR is the leading think tank and research center focused on building the long-term economic security of women and families. And we've been around for about 33 years. And so actually this moment, thinking about how to restore an economy or build an economy that works for everyone is a conversation that we've been teeing up for some time. And so this moment provides us an opportunity to really have that conversation and reimagine an economy that works for all.
Now, how are women, and particularly women of color and poor people, more impacted by the coronavirus than white people?
People across race, across socioeconomic class are struggling to stay afloat. And what we see here is that people who were struggling before the virus are disproportionately impacted now because they have fewer savings, they're living paycheck to paycheck, and they're often in lower wage jobs, which, as we see with the unemployment claims recently, many of those jobs have been shed during the pandemic.
Are they also in industries where their jobs are less likely to ever come back? For example, a Hispanic friend of mine, his wife, worked for 8 years for a Hula Hands restaurant in Maryland as a server, and they closed the restaurant because of the impact of the coronavirus.
Absolutely. So what we're seeing now is that many of the jobs that have been lost have been in the service sector, and those jobs are predominantly have people of color, lower income individuals in those sectors. And so what we know is that even though, for example, 21 million unemployment claims have been made in the last month, when we begin to recover, we know that we're not going to be at 100% employment. And what we know is that some of those businesses were struggling beforehand, and they're just simply not going to be able to reopen their doors.
But what percentage of those businesses were, say, in high tech, which would employ higher income people, versus servers and another industry that I can't think but that it will be beefed up after this would be the healthcare industry, and a lot of low-income people of color are getting, BAs or associate degrees that allow them to join the healthcare industry, like nursing assistants or physician's assistants, those kinds of things.
So what we know is that there are certain sectors that are growing. So education, healthcare, and even before this, the service sector was growing. But what we know with those was that those jobs, many of those jobs were economically vulnerable jobs. They were jobs that paid lower wages and jobs that had fewer benefits. So even in the healthcare industry, there's a segment of workers who were not RNs or doctors, who were lower level healthcare workers like home health aides and CNAs, who have been impacted by the pandemic and did not have health insurance, for example, so that they didn't have a choice about going to work, but also didn't have the benefits in case they became sick.
Forbes had a little piece, I think it came from a study that y'all did, showing that, and I know this is a tiny bit of possibly decent news in a sea of bad news, but it showed that restaurant service workers, women, made 89% of what men made in those jobs. And again, we're talking about low-income jobs. But and there were several other sectors like that, why is it that women in those service industries make so much closer to what men, we're still at something about like 70, women on average make about 70 cents for every dollar, and it's much lower for Black women and Hispanic women and Native American women, etc. But that women on average make 10 cents more compared to what men make in those service industries. I was intrigued by that.
So actually, it's women earn 82 cents on the dollar on average compared to men, and for Latina and Black women, they earn less. There are only a few sectors that women out earn men. And nearly all of the other sectors, and most sectors, men, regardless of the sector or occupation, out earn women. And that includes actually retail and the service sector. So even when men are in jobs that are predominantly female or women, they still out earn women. So what we see now is, when we think about the pandemic, is that women were earning less, and that has an impact in times like this, because that means that they have less money saved. They also have less money to provide for their families. Housing is an issue, particularly in this moment, as well as, providing for basic necessities. So the wage inequality, the pay gap, definitely impacts how women will do in this particular economic crisis.
But why is it? So you say women on average now are making 82 cents on the dollar for every dollar a man makes. I was a little behind on the statistics. The last time I checked, it was about 78 or 80 cents, something like that. Okay, but even so, in restaurant service jobs, they make 89 cents for every dollar. So they're much closer to what men earn in those fields. Is that because it's a low-income field, and it was at one point exclusively reserved for women because it paid so low, but now men, because they need jobs, are getting into it? Like nursing, for example, was not a great paying job 20 or 30 years ago. Now there are nurses making well into the six figures. So guess what's happening? More men in that industry. In other words, men are attracted to all female industries when the pay starts to go up. Is that what is happening in the restaurant service industry?
Many restaurant workers are still, unfortunately, depend on tip wages or tipped earnings. And that can vary from restaurant to restaurant. And so I think we would have to unpack those numbers a little bit. But in general, what we still know is that even though the gap is a bit closer in the restaurant industry, women are still earning less. And again, we don't want to overstate this, but these are lower wage or lower paying jobs in general, in fact. So when we think about, you pointed out the nursing field, so more than 90% of women are nurses, but what we know is that when men are nurses, or when men enter the sector, they out earn women with the same skills, and even in some cases less experience. So this is a really systemic problem, institutional problem, and it really goes to the core of what do we believe that women earn, and what's the value of their work?
You have recently announced a student parent success initiative. Please tell me about that.
So the Student Parent Success Initiative is one of many parts of our work where we are really, again, as we move into a higher tech and we're relying on a highly skilled, highly educated workforce, making sure that the women who have been left behind in these first waves have access to higher education and opportunity. And what we know is that many of the women who are struggling day to day to make ends meet are parents. And so what we are working with organizations and foundations and our philanthropic partners is to make sure that women have access to education and training so that they can be able to provide for their families.
Yes, I read somewhere many years ago that a PhD female, just getting out of school, and a PhD male, she made 98 cents on his dollar. And now, maybe, are there any fields where women earn more than men? since the evolution of technology and its impact on the economy?
Well, definitely not in technology or in very high skilled jobs. There's still a significant and notable pay gap. And what we know is that when we provide women with training, skills, and opportunity for advancement, they take advantage of it and they lean into it, and are should be rewarded for the skills that they bring to the table. And right now, they're just not across many, if not most, all sectors. In some cases, it's regardless of educational attainment levels.
Now, the coronavirus obviously only hit a few months ago, but is there enough research being done on the gendered impact of the coronavirus on the economy and hurting women and communities of color more than upper income communities?
We know that 60 to 70% of the jobs lost were jobs lost by women. And so trying to understand why that is the case and what that means for women's long-term economic security and their recovery following the pandemic. And we know that that same thing to be true for workers of color, and understanding, again, not only is this about the economy, but it's also about the lack of health insurance and the other benefits that provide a safety net for families that we realized and we knew before that many women, lower income workers, and people of color simply do not have access to.
Your organization has called the pandemic a wake-up call for changing and liberalizing laws on working from home or rules, I should say, and what the virus will do in terms of influencing domestic violence as well. Please explain those 2 points to me, if you don't mind.
Yeah, so just a few months ago, we were talking about how we had such a booming economy and it was primarily defined by the strength of the stock market and low unemployment numbers. But what we knew then is that it really masked the reality of many families, working families who were living paycheck to paycheck and really felt economically vulnerable. So what this pandemic has done is to reveal those cleavages and those gaps in people's day-to-day realities. And we have a lot of work to do to make sure that the economy doesn't just work for those at the top, but works for everyday people and citizens. And so what we're learning a lot through this pandemic, actually, and it's revealing a lot, but it's also, it will and it has, and I'm really excited about it, provides us an opportunity to think about the kinds of policies, the strategies we need to make sure that everyone, regardless of where they sit, is, economically secure.
How do you do that? What are your suggestions for making women of color and communities of color economically secure?
We really need to think about making sure that everyone has access to health insurance and benefits that are not necessarily tied to an employer, but that people can take with them and they own the benefits. So I think that's one thing. I'm also a proponent, and we are already thinking about it in terms of universal basic income, regardless of your economic status, and basing it on need versus income and earnings. And so, again, we're in a moment where we can really imagine our economy and one that works for the people who, what we realize in this pandemic moment, or, because of COVID-19, is that it's the workers and the people and the American citizens who create and make the economy, and not the people at the top and the corporations. And so we need to do our best to make sure that they are protected, and we also need to lead with our values.
Are there any data out there yet, or is it too soon, on how the COVID-19 virus has affected people, the number of people with health insurance in this country? And if not, pre-virus, how many people were completely uninsured?
Well, we do have the numbers of how many people were uninsured, and it was a lot. And many people felt very vulnerable. So, for example, one of the things we worried about at the beginning of the pandemic is that the cost of care, so going to get tested or screened for COVID-19, was cost prohibitive for people, even those who had health insurance. And so how that might have caused or contributed to the spread of the virus because people were reluctant because of the lack of health insurance or the cost of care to get tested.
Congresswoman Katie Porter from California did push through when she was on a committee that had a hearing with the head of the CDC before her. She made him promise that testing would be free for all Americans.
That's actually, thank you for saying that, but that was probably about 2 or 3 weeks into the virus. And so there had already been some harm, I would say. And so I'm very grateful for Katie Porter and her being able to push that. But what we know is that testing has been far and few between, especially in particular communities. So want to lift that up. But when we think about the loss of jobs, many people are unemployed and have lost their jobs, which also means that they've also lost access to health benefits and insurance. And it's not just for them, but in many cases, it's for their entire families. And so one of the things I'm really have been excited about and encouraged by is that in the stimulus packages, there has been provisions for paid sick leave for families, but it doesn't go nearly far enough because it excludes many of our biggest and largest employers and many of the employers that employ many low-wage workers. And so what I would like to see in the new and next rounds of stimulus is that there are provisions to provide for lower wage workers who were excluded in the first round of packages to make sure that they do have access to health care and health insurance.
Do you think all the changes that will be made by, at least at this point, a Republican-controlled Senate and a Republican president will help or hurt women in terms of being impacted, and women of color being impacted by the coronavirus?
What I'm really grateful about in this moment is that we do have a Democratically controlled House of Representatives, and they control the purse strings. And so it's made it really harder for a Senate who is sometimes punitive towards lower wage workers, people of color, and women to ram through some of the things that I think if we had not had a democratically controlled House of Representatives would be possible. And so what we see is that the Senate has to negotiate with the House in order to get through many of the packages and that they need to get to the American people. But at the end of the day, what I really believe is that we need to put the American people above partisan politics and really do what's in the best interest of workers and families and women and communities of color.
Did you look closely at the stimulus package, the first one that passed? Did it meet your satisfaction in terms of helping communities of color?
Absolutely not. And I think the first package, while I think it was a valiant effort and we really needed that $2 trillion infusion into the economy to really help to keep people afloat, but it wasn't nearly enough. Again, many workers were left out of that package, undocumented workers. I'm encouraged by the $1,200 that went out to families and individuals, but that's not nearly enough. What I like about the new stimulus bill that they're considering is they're considering $2,000 per month until we're out or until unemployment numbers reach pre-pandemic levels. And I think that's a really good idea. Again, we need to put money in the hands of people who need it most. And one of the lessons that I think we should have learned from the 2008 recession is that we need to put money in the hands of people and communities rather than pumping that into large corporations and businesses and hoping it will trickle down.
Most of the healthcare workers, at least at the lower levels of pay, the nursing assistants, the physicians assistants actually are reasonably paid, but the nursing assistants and below them, all the workers below them, most of them are women. And in New York City, for example, every day at 7 o'clock, people lean out of their windows with drums, bang on the drums, and yell hip hip hooray and sing songs and do that to thank those healthcare workers. I don't know if that's being done. It's probably being done in other places around the country as well, but how do you take that energy and translate it into federal, I guess you're looking for federal support for these workers, right?
We need hand claps and we love encouragement and we love support. But more than that, we need people to get out to the polls and vote their values and vote in a way that makes sure that the most vulnerable people and even workers have the necessary protections and living wages and quality jobs that they need to be able to take care of their families. So I am, again, encouraged by the ways in which everyone has come together and have been united around our workers and our frontline people. But there's so much work to be done. And so in this moment, in addition to rallying behind the people who are on the front lines, we also need to be putting pressure at both the state and the federal level to make sure that the people most in need of support and, a hand up in this time get it.
Do you have any data yet on the percentage of women versus men who filed for unemployment and the percentage of people of color who've filed for unemployment? Because at least I heard in the beginning of the pandemic, more men were getting sick than women. Was that the case? I could be wrong on that. And if not, what are the percentages of by gender, if you know it, of people coming down with not just testing positive, but actually coming down with COVID-19?
So that's a really good question. And what we've seen and what we know is that people who have come down with it and the people who are able to survive it are two different demographics or kinds of people. And so we know that the virus and the pandemic is worse for people with extenuating or exacerbating underlying health conditions. And unfortunately, disproportionately, many of those are people of color or people who don't have access to adequate care, and health insurance. So when we think about the unemployment numbers, and I wanted to address the first part of your question, is that we know that women have been disproportionately impacted by the layoffs because this, to be really very clear, is a service recession, and women are predominantly in these service sectors or these ones that are disproportionately impacted. So what we have seen in our research, and the Department of Labor, also has seen, is that 60 to 70% of job loss has been by women or unemployment claims. Now, what we are waiting to understand, and we'll try to get some understanding soon, is how many of those are women of color or people of color, and how we, are able to disaggregate those numbers. But what we know for sure is that because people of color are overrepresented in the service sector, we know that it's having a disproportionate impact on those people and those families.
Do we have any idea by gender, how people are going to be impacted by jobs that never return? In other words, who's going to be what percentage of people are going to be what are the highest percentage of unemployed when the pandemic, we hope, is over?
So that's a really good question. And what we know is that we're not immediately going to go into 100% employment, meaning that the number of jobs that we lost during the pandemic, when it recovers, we're going to have 100%. We're going to get all of those jobs back. That's just not going to be possible. And service and sectors that were already struggling before the recession. So, for example, retail was struggling before the pandemic, and some smaller businesses, restaurants were struggling as well. So many small businesses or restaurants said that they could go maybe 2 weeks or a month without pay or business. And as you know, we're going into the third or the second month of the pandemic. And so unfortunately, many of those businesses will not survive and be able to open their doors and be 100% over the next couple of months. And what that means is that people will not return to work. And so that is why many of the initiatives that are geared towards retraining, upskilling people, educational opportunities, people going back to school and, obtaining degrees are critically important in this moment, because many of those jobs won't be coming back. And the last thing I'll say is that is also why we need continued support of families. The social safety net has been shredded over the last few few decades. And so what we see right now is that without that social safety net, many families are really vulnerable and don't know which way to turn. And so we have to do something in the short term and the near term to make sure that we have a strong, solid social safety net for families in this country.
Thank you so much, Dr. C. Nicole Mason, head of the Institute for Women's Policy Research. Really appreciate your time and your vast knowledge in this field. That is it for this edition of To the Contrary. I'm host Bonnie Urbay. Please, in between shows, join us on our website, which is tothecontrary.org. It's part of PBS's website. And whether you agree or think to the contrary, please join us next week.
Funding for To the Contrary provided by the E. Rhodes and Leona B. Carpenter Foundation, the Colcom Foundation, and the Charles A. Freoff Foundation. For a transcript or to see an online version of this episode of To the Contrary, please visit our PBS website at pbs.org/To the Contrary.
Be more. PBS.